But I do find it interesting that my colleagues are seeking to talk about everything other than the bill that has been passed into law. And I find it interesting today, for the first time, we've had an opportunity to talk about some of the flaws, especially in their claim that this is a budget reducer when they've used a 10-year window, 6 years of services, 10 years of taxes, disingenuous at best to the American people, that we've established today that it, in fact, cuts $500 billion from Medicare. Oops, didn't want to tell you about that, did they? And what is the impact today to the real person out there who's trying to keep their job or find a job is that health care premiums have gone up and people are losing their coverage today because of this bill. I wouldn't want to talk about this bill either if I were you. As a matter of fact, the administration now has had to give, they haven't updated it, it's 1,040 waivers that impacts about 3 million Americans, and said you don't have to follow the law because it will either A, increase your premiums, or B, you'll lose the health care that you want to keep. So they had to say, guess what, you 3 million Americans? The rest of America, you're stuck with this thing. You 3 million Americans, don't worry about it. Don't follow the law. You're right. I wouldn't want to talk about what this bill is doing to real working Americans today either. Pretty frustrating. I hope we'll get more chances to talk about the details of this bill. I do have a couple of quick questions if I can. Mr. Foster, when you did the calculation, you calculated that 20% of small business employers would no longer offer health insurance. So, by the way, that's 1 out of 5 small businesses will no longer offer health insurance to their employees, something else I wouldn't want to talk about. But I'm curious about how you got there. The average cost in a state like Michigan, about $15,000 per employee, and the penalty for not offering insurance under Obamacare is $2,000 per employee. Now, I don't know if you've been around many small businesses outside of the Beltway here, but they are absolutely under assault from cost increases, fuel cost increases, mandates that are increasing their cost of their products. Pretty difficult decisions have to be made, which is one of the reasons a place like my state is still suffering one of the highest unemployment percentages in the country. So if you're a small business owner and you're facing $15,000 per employee to try to do the right thing, or $2,000 that you just send off to the federal government and get to throw them off your plan, you've got to help me understand how you get to only 20% of small employers are going to throw their folks off their health insurance that they enjoy today. Can you help me understand that?
Sure, I'll give it a try. As part of this, you have to estimate the behavioral response of providers, individuals, businesses, any number of groups, and employers are one of the most important groups. Now, for some employers, of course, if you're a small enough business, then you're not affected and you get some subsidies to help out. But for businesses that tend to have relatively low-income workers, it can turn out to be sort of a win-win for them to drop their formal coverage, health insurance coverage, and assist their employees into getting coverage through the exchange.
So just so I understand it, you think it's beneficial for them to drop their coverage and send people to the federal exchange? Did I understand that correctly?
For certain categories, primarily businesses with relatively low-income workers.
So that's interesting. I'm going to add that to my list today, that the bill encourages small businesses to drop their coverage and send people on the federal exchange. Brilliant. Absolutely brilliant. Here's the other problem with your 20%. Maybe you can help me out. And there's going to be a great second panel here. One of the restaurant owners did the calculation. He only has 33 full-time employees and roughly 26 full-time equivalents working part-time hours, totaling 59 full-time employees. And then he has seasonal and full-time employees for certain parts of the year and not parts of the year. Restaurant business is a pretty tough business. You know, margins are very small. Sometimes the business is up, sometimes it's done. In a state like Michigan, it tends to be more seasonal given the tourist season. If he follows the law as it is, right, and under your equation, he would be one of those that would want to do that, but it's a 282% cost increase, and it's done because of the way you calculate part-time employees as a full-time employer. So he's one of those folks that's going to get caught right in the middle of this thing that should be getting the subsidies, but because the way you calculate or the law calculates, I don't know if you've made that calculation in that 20% number. Did you?
The 20% is an assumption. We won't know until down the road and we see what happens.
Right. And it's assumption, as he said today, Mr. Chairman, based on behavior. And if you've been in a small business with these kind of cost increases, you're going to throw people off your insurance. That's why we all ought to be angry about what this bill is doing to the very working men and women of the United States.
Gentleman's time has expired.